So household air pollution basically means when in your home you cook using fuels like charcoal, like firewood, which when used they produce a lot of smoke. So what happens that if a mother, for example, is cooking and using those sources of fuel, they inhale the smoke. When you look at what we call the risk factors for diseases like pneumonia, like asthma, like what we call chronic obstructive pulmonary disease, heart diseases, stroke, it is the third. Of all the things that can make you get asthma, of all the things that can get you pneumonia, it ranks among the third. So it's really a big problem. Now the unfortunate bit, many times our communities do not perceive it as a problem, it's a health problem. Because like I mentioned earlier, when you're cooking within a kitchen and it's smoky, your eyes get irritated, a few tears, and when you get out, you think you're okay. But you've inhaled a lot of smoke. So the effects of being in a smoky kitchen, many times I experienced later on in life. So it's difficult for you to attribute it to the fact that you are in a smoky kitchen. So that is another burden where, much as it causes a lot of problems, but people are not aware. So some of the health problems it causes, pneumonia, we know that 50% or 5 out of 10 cases of pneumonia may be attributable to being in a smoky kitchen. People who have asthma, once they're exposed to that smoke, they run into hospital because they are no longer breathing, they are wheezing, and they need medication. That's a cost. And yet if you are in a cleaner environment, you would not have to look for money to run to the hospital. Heart diseases, when people get heart attacks, there is what we call coronary heart disease, which manifests as a heart attack. Some of those heart attacks people get are because of exposure or the effects of this air pollution from cooking. The strokes that I mentioned, the chronic pulmonary obstructive disease. So it's the kind of problem that cuts across all age groups, whether you're young, whether you're old, whether you're healthy. And sometimes even the rich are affected because they still use the charcoal, they still use the wood. They want to have their barbecues and they're using that. So it's a problem that cuts across the different social classes, the different age groups. And so we really want to increase the awareness about this problem so that people can individually think through methods to reduce the problem. But also, once they have the knowledge, they can work with their communities or appeal to the governments to put in place certain things that can actually help solve that problem.
The government has a plan to increase LPG access up to 20%. Currently, there is a national LPG program for Uganda that is targeting the dissemination of 13 kilogram cylinder kits. So this is the kit on the left. I'm sure you've seen something like this, and the cylinders are being recirculated in the market. So far, 20,000 have been disseminated so far, and here you only pay 100,000 for the gas that is in the cylinder, but you get the whole kit, that whole kit free of charge. And here we want this program. We are targeting vulnerable communities who are affected by the high upfront cost of cylinder kits. Then so far, about 20,000 have been disseminated. But what are the future plans? We estimate to start producing our own gas in Uganda in 2025. As part of the oil and gas activities in Tilenga and Kingfisher. And then also, in the long term, there is also a plan to produce more gas from the refinery.
The project we are going to implement is in the broader or bigger project called the Clean Air Africa program. And we are focusing on what we call household air pollution.